Early signs of prostate cancer. Picture this. You wake up at 3 a.m., you go to the bathroom, you go back to sleep. You wake up at 5 a.m., you go again. You think, I just drank too much water. You think, I'm getting older, this is normal. And then you do absolutely nothing about it. That right there, that moment of dismissal, is exactly how prostate cancer steals a decade from men who had every chance to catch it early. Here's the stat that stopped me cold. Prostate cancer kills over 375,000 men every year. And the terrifying part? Most of them had warning signs, years of them, and they either didn't recognize them or they recognized them and did nothing. Today, that changes, because in the next 10 minutes, I'm going to show you what those warning signs actually look like, why they're so easy to miss, and what the science says you should do right now. This is not a scare tactic. This is information that could add years to your life. Let's go. Meet the prostate, the organ nobody talks about until it's too late. Here's something almost nobody knows. Most men go their entire lives without properly understanding what the prostate does until the day a doctor tells them something is wrong with it. So let's fix that right now in about 60 seconds. The prostate is a small walnut-sized gland sitting directly beneath your bladder. And here's the detail that makes everything else make sense. It wraps completely around the urethra, the tube that carries urine out of your body. Think of it like a donut wrapped around a straw. When the prostate is healthy, everything flows smoothly. But the moment that gland starts to grow, whether from cancer or any other reason, it begins to squeeze that straw. And suddenly, going to the bathroom becomes an ordeal you never expected. The prostate also produces PSA, prostate-specific antigen, a protein that's going to come up again later in this video, and whose story is far more dramatic than a simple blood test result would suggest. But here's the twist in the anatomy that most people never hear about, and this is crucial. Prostate cancer almost always starts in the outer part of the gland, the peripheral zone, which sits away from the urethra. So in its earliest, most treatable stage, cancer isn't squeezing anything. It isn't blocking anything. It isn't causing pain. It is completely, utterly, dangerously silent. And that silence is the whole problem, because while a man is living his normal life, working, exercising, feeling fine, cells inside his prostate may be quietly, methodically turning cancerous, doubling, spreading, buying time. According to data from the National Cancer Institute, more than 60% of prostate cancer cases are diagnosed in men over 65. And here's what that number really tells us. Years of silent growth. Years of missed opportunity, years where early intervention would have changed everything. But here's the good news, and I mean this. The warning signs do eventually show up, and when they do, if you know what to look for, you have a real chance. So let's talk about those signs. The symptoms and the trap they set. This is the part of the video that could genuinely change the trajectory of your health. Pay attention. When prostate cancer begins to grow large enough to press on surrounding structures, or when it develops near the urethra, it starts producing symptoms, and the maddening part is that those symptoms look almost identical to a completely harmless condition called benign prostatic hyperplasia, BPH, a simple non-cancerous enlargement of the prostate that affects over 50% of men by age 60. Same symptoms, different cause. One harmless, one potentially deadly. This overlap is the trap, and millions of men fall into it every year. So what does it actually feel like? The bathroom is changing, and you're pretending it isn't. You're waking up 2-3 times a night to urinate. Your stream is weaker than it used to be. It starts and stops, trickles when it used to flow. You stand there waiting to start, you finish, and still feel like you haven't fully emptied. You feel sudden, desperate urgency, like you have maybe 60 seconds or you're in trouble. Sound familiar? Here's what's happening biologically. The growing prostate is compressing the urethra, squeezing that straw tighter and tighter. Your bladder now has to work harder to push urine through a narrow channel. Over time, the bladder muscle strains, the bladder never fully empties, and the cycle gets worse. These are not signs of aging you simply accept. These are your body raising a flag, politely at first, then with increasing urgency. Most people don't realize that these symptoms, even when caused by totally benign BPH, still warrant a full prostate evaluation to rule out cancer. The symptoms don't tell you the cause. A doctor and the right tests do. Blood, the symptom you cannot ignore. Blood in your urine, even a faint pink tinge that disappears, or blood in your semen, is not something you explain away and forget about. Medically, this happens when growing tissue erodes small blood vessels. It can have benign explanations, but in no scenario is blood in urine or semen something you monitor from your couch and hope resolves. Same week medical evaluation. No exceptions. The symptom men never bring up, but should. Here's the part nobody talks about. New or worsening erectile dysfunction, particularly in a man with no obvious cardiovascular risk factors, no new medications, no psychological stressors, can, in some cases, be an early marker of prostate cancer. The neurovascular bundles responsible for erections run in extremely close proximity to the prostate. A growing tumor can exert pressure on these delicate nerve structures. Research published in the Journal of Sexual Medicine has found that erectile dysfunction can precede a prostate cancer diagnosis by months to years in some patients. Now, erectile dysfunction has dozens of causes. This alone doesn't mean cancer. But a man who is experiencing new erectile dysfunction and urinary changes and is in a higher risk age group, that combination deserves a complete evaluation. Not Google, not 6 months of waiting, a doctor. Pain, what it means when it finally arrives. Persistent, unexplained pain in the lower back, hips, or pelvis, particularly pain that doesn't resolve with rest or typical treatment, can indicate that cancer has spread to bone. Prostate cancer has a well-documented preference for bone metastasis. It travels through a venous network called Batson's plexus, a direct highway connecting the prostate to the spinal column. Countless men have been treated for bad backs for months before anyone thought to check the prostate. I'm not saying every backache is cancer, obviously it isn't, but persistent, unexplained bone pain in a man over 50 should always prompt a full workup, and the prostate should be part of that conversation. Who is actually at risk, and why the answer matters more than most people think? Not every man carries the same risk, and knowing where you sit on the risk spectrum changes everything about when and how aggressively you should be screening. Age is the single most powerful risk factor. Prostate cancer before 40 is extremely rare. After 50, the risk climbs. After 65, it surges. If you are a man in your 40s watching this, you are in the window where prevention and early screening conversations begin. Race reveals one of the most striking and heartbreaking disparities in all of medicine. Black men are approximately 75% more likely to develop prostate cancer than white men, and more than twice as likely to die from it. This disparity reflects a combination of biological, genetic, socioeconomic, and healthcare access factors that researchers are actively working to understand. The clinical implication is clear and non-negotiable. Black men should begin the screening conversation with their doctor by age 40 to 45. Family history matters enormously. A father or brother diagnosed with prostate cancer roughly doubles your risk. 2 or more affected relatives push that risk higher still. Genetics go beyond just prostate cancer in the family. Men who carry BRCA2 mutations, most famously associated with breast and ovarian cancer in women, face significantly elevated prostate cancer risk, and when they develop it, it tends to be more aggressive. If BRCA mutations run in your family, that is a conversation you need to have with your doctor for your prostate specifically. Diet and body weight are modifiable, meaning you actually have control over them. Diets high in processed red meat and saturated fat, paired with obesity, particularly abdominal fat, are associated with more aggressive prostate cancer biology in multiple epidemiological studies. You can't change your age or your genetics, but you can change what's on your plate.
The PSA test, the most controversial blood test in medicine. This changes everything we thought we knew about prostate cancer detection. For decades, PSA testing was treated like a simple smoke alarm. PSA goes up, danger. PSA normal, all clear. Straightforward, except it was never that simple, and the medical community spent years learning that the hard way. Here's what PSA actually is. It's a protein produced by prostate cells, normal and cancerous alike. When prostate cells are disturbed, more PSA leaks into the bloodstream. The blood test measures that concentration. The problem? PSA is prostate-specific. It is not cancer-specific. BPH raises PSA. Prostate inflammation raises PSA. Vigorous cycling raises PSA. Even ejaculation in the 48 hours before a test can raise PSA. All of this creates false alarms. Elevated PSA leading to biopsies, anxiety, and procedures that find nothing dangerous. And then there's the opposite problem. The PCPT trial, Prostate Cancer Prevention Trial, published in the New England Journal of Medicine, found cancer in 15% of men whose PSA was below what was then considered the normal threshold. Normal PSA, cancer present, missed. So where does that leave us? Modern medicine has gotten significantly smarter about this. Today's urologists use PSA velocity, how fast PSA is rising over time, PSA density, PSA level relative to prostate volume, free to total PSA ratios, advanced biomarkers like the Prostate Health Index and the 4K score, and critically, multiparametric MRI, which can visualize suspicious lesions in the prostate with remarkable precision before any biopsy needle goes anywhere. The ERSPT trial, a massive European study tracking over 160,000 men, demonstrated that PSA-based screening reduced prostate cancer mortality by 20 to 30% at 16-year follow-up. That is a significant reduction in men dying. But the same trial identified overdiagnosis, finding slow-growing cancers that would never have threatened the man's life, as a real issue. This is why PSA screening is now a conversation, not a checkbox, a shared decision between you and your doctor, factoring in your age, your risk profile, your values, and what you'd want to do with the information. Current guidelines recommend that conversation starts at age 50 for average risk men, age 45 for Black men and those with a first-degree relative diagnosed before 65, age 40 for men with multiple affected relatives or known high-risk genetic mutations. Not when symptoms appear, before that. Because remember, early cancer doesn't announce itself. Myth demolition. 3 lies that are actively dangerous. Let's be blunt about 3 myths that are actively dangerous. Myth 1. If it was serious, I'd feel it. No, you wouldn't. Not in the early stages. We have now established in detail that early prostate cancer produces no symptoms in the vast majority of cases. Feeling fine is not medical clearance. Feeling fine while cancer grows quietly in your peripheral zone is the entire reason we screen. Myth 2. Prostate cancer is slow. It'll probably never kill me. Some prostate cancers are indolent, slow-growing, low-grade, unlikely to threaten your life. Active surveillance for these cases is increasingly standard practice. But high-grade prostate cancer, Gleason 8, 9, 10, is not slow.
It is aggressive, it metastasizes, and it kills. The challenge is you cannot know which type you have without evaluation. Assuming the slow kind is a gamble no man should make blind. Myth 3. I'm too young to worry about this. If you are in your 40s, you are in the age range where your risk is beginning to climb, where genetic and lifestyle factors are exerting their influence, and where the conversations about your baseline PSA and risk profile should already be starting. The men who do best with prostate cancer are the ones who started paying attention before they had any reason to be alarmed. Conclusion: the numbers that should make this real. Before you close this video, I want to leave you with two numbers side by side. Prostate cancer caught early, stage 1 or 2, still inside the gland, carries a 5-year relative survival rate of nearly 100%. Prostate cancer caught late, after it has spread to distant organs, carries a 5-year survival rate of approximately 34%. Same disease, completely different story. The only variable is timing. Early detection does not mean automatic surgery, automatic treatment, automatic life disruption. Modern medicine offers active surveillance for low-risk disease. It offers precision imaging before biopsies. It offers options, because options only exist when you find it enough to have them. So here is what I'm asking you to do. Not for me, for yourself. If you are over 45, or over 40 in black, or over 40 with a family history, book an appointment with your doctor and ask specifically about prostate cancer screening. Have the PSA conversation. Know your baseline. If you have urinary symptoms, a weak stream, frequent nighttime urination, hesitancy, urgency, get a prostate evaluation, not eventually, soon. And if you see blood in your urine or semen, you call your doctor this week. The men who survive prostate cancer at the highest rates are not the ones who were lucky, they are the ones who paid attention. Send this video to someone who needs to hear it. A father, a brother, a friend who hasn't seen a doctor in 3 years. Sometimes the most important health decision in someone's life is one they made because someone cared enough to send them a video. And if you want more medical content that gives it to you straight, science first, no fluff, no fear tactics, subscribe to this channel. Because next week, we are covering something that is quietly destroying men's health across the world, and almost nobody is connecting the dots. Take care of yourselves, see a doctor, and I'll see you in the next one.